My name is Christina, and this presentation will discuss the potential positive and negative psychological effects of anabolic steroids. So let's begin with who uses anabolic steroids and the reasons why. Healthcare providers administer anabolic steroids for the treatment of hormonal issues, for instance, delayed puberty, and also diseases which cause muscle catabolism. However, the reputation of anabolic steroids is widely linked to the performance enhancement within a variety of sporting fields. Several athletes in sport and exercise engage in performance-enhancing drugs to gain a competitive edge. Anabolic steroids are one of the most commonly used and most publicized drugs engaged by athletes, due to the benefits of shorter recovery periods, enhanced performance, strength, and endurance. Anabolic steroids are not only used by professional athletes. Bodybuilders, powerlifters, and recreational users turn to the illicit use of anabolic steroids for the purpose of increasing lean muscle mass, strength gains, enhanced cosmetic appearance, and an overall improvement to their physique. So what exactly is an anabolic steroid? Well, the scientific name for this drug is anabolic androgenic steroid, or AAS. AAS steroids are derivatives of the male sex hormone testosterone, which have been chemically modified to remain in the bloodstream and prolong the metabolic half-life of the parent molecule and its efficiency. The prolonged duration in the bloodstream stimulates proteins to promote tissue growth and help build lean muscle mass, which help the user increase strength, power, and endurance. The anabolic effect of this synthesized drug increases tissue building of skeletal muscle while minimizing androgenic effects. Some anabolic effects include increases in bone density, muscle mass, red blood cell mass, hemoglobin concentration, increases in protein synthesis, nitrogen retention, electrolyte retention, and immune system enhancement. So how exactly are anabolic steroids used? Anabolic steroids are most commonly used orally in the form of a pill or by injecting the substance directly into the muscle. The term cycling refers to the common approach of dosing the substance for a period of 4 to 18 weeks while alternating with a drug-free period. Stacking is another approach of steroid use, which involves the use of a combination of 2 or more steroids at one time. Pyramiding is another common method which allows the user to gradually increase the dosage until a peak is reached before tapering off. The drug is commonly taken in these various ways in an attempt to reduce or control the negative effects of the substance. However, there is no evidence to support this belief. So let's take a look at some of the psychological factors that anabolic steroid use have on the user. We'll start by discussing some of the positive effects. Between the years of 1930 and 1970, anabolic steroids were used in clinical settings to successfully treat depression, melancholia, and psychosis. Generally, the positives of steroid use on the psychology of the user are linked to the strong positive emotions experienced when performance or physique is enhanced. The result of using anabolic steroids are accompanied by short-term results of increased skeletal muscle or strength gains, but the long-term negatives are most often not thoroughly considered. Or if they are, the intensity of self-confidence is increased to the point that for the user, it outweighs potential long-term negatives. Self-confidence is vital in the development of motivation and important for an athlete's success, as motivational factors strongly influence physical performance. Anabolic steroids have the potential to enhance self-confidence through increases in self-efficacy. The increase of self-efficacy is in association to anabolic steroid use has been shown through several studies. A study was conducted on 11 national level powerlifters where psychological expectancy effect was strongly evident. All lifters improved their 1 repetition maximum in the first trial due to the belief that they had consumed a strong dose of AAS. Pre-second trial, however, 5 of the lifters were told the pill was a placebo, and as a result significantly dropped below the baseline, while the remainder 6 powerlifters who believed the pill contained AAS once again recorded a performance above baseline. The lifters' beliefs about the effectiveness of AAS was successful in increasing their performance. This shows how anabolic steroids can potentially increase the user's beliefs of their own capacity to execute behaviors necessary for a successful performance. It also shows the induced feelings of increased strength from engaging in AAS use alone. There are 2 key studies which discuss the improved self-perceived emotions of anabolic steroid users. In-depth interviews were conducted in both studies to assess the psychological experiences the users had while taking AAS. In the first study, 9 out of 10 athletes reported having a positive psychological experience. They perceive themselves as significantly more confident, more alert, more effective, as well as experiencing enhanced social recognition, social acceptance, and sexual attraction. In the study, 39 men who were users of AAS participated in in-depth interviews. In this second study, 37 of the men reported a profound positive experience, such as significant increases in confidence, perceptions of well-being, and feelings of a euphoric mental state. The men reported feeling stronger, mentally invincible, and felt incredible superiority over others. One man reported saying that the experience during AAS use was one of the best feelings in the entire world, while the other claimed that during AAS use, it was the best he ever felt about himself. The study found that the enhanced physical effects of AAS use were tied very closely with the psychological effects experienced. When the men entered a drug-free period, they reported experiencing a drop in self-confidence equal to or below pre-AAS use levels. This drop in confidence levels and loss of the mental edge factor were motivating reasons for continued use of the drug. This dependency on anabolic steroids is a key negative psychological effect of its use. One of the men interviewed acknowledged that he experienced more of a psychological addiction to the drug, where he perceived that to stop AAS use would not impede on his strength gains, but he would ultimately lose his mental edge. When we look at other potential negative psychological effects of AAS use, key consequences are present. Mood instability, nervousness, irritability, hostility, and feelings of aggressiveness have all been linked to AAS use. Research suggests that the tendency to display these behaviors, particularly aggression, together with a lowered tolerance for frustration, is increased significantly in negative circumstances. Many of these adverse effects of anabolic steroids might be present without obvious warning signs. In his research, Dalby reports a case where a low dose of anabolic steroids had detrimental effects on the user, which ultimately resulted in a jail sentence. The 20-year-old young male reported feelings of depression and violent rages following a 5-week cycle of AAS use. He received a 1-year jail sentence for involvement in a robbery where the judge ruled AAS as a mitigating factor in the commission of the robbery. Psychological negative effects of AAS use go beyond the behavioral consequences displayed while the substance is being used. They extend to years after the drug use is stopped. This is because most of the physiological effects which occur in relation to AAS use are for the most part irreversible. Masculinity is central to self-esteem for males who elicit AAS for physique purposes. A loss of masculinity triggers anxiety. Even after AAS use is stopped, males can experience more fatty tissues build up in their chest. This, along with possible reproductive consequences such as testicular atrophy, erectile dysfunction, baldness, and decreased libido, can have a negative effect on the user's levels of self-esteem, leading to symptoms of depression. For women, negative side effects of AAS use differ from men. With the hormone fluctuations, an array of undesirable effects can be experienced, leading to symptoms of depression. Some of these include enlargement of sexual organs, deepening of the voice, increased facial hair, menstrual disorders, acne, and possible infertility. More research on the psychological effects of anabolic steroid use years after the drug has been stopped would further demonstrate and address the scale of positive and negative psychological effects on the user. Thank you for your time.